This is Mr. G with another flipped classroom PowerPoint lecture. This one will be covering grooming, hair care, and shaving, the first parts of chapter 23. So let's first talk about grooming. As teenagers, you know how important grooming is. It's become very important in your life because you like to look good in front of your friends. Well, it's no different as life goes on. Grooming continues to be important. There are few people who do not find grooming very important, and it's pretty evident when you see them that they don't seem to have any importance with it. But the other part of it is that it does prevent infection and promotes comfort. Anybody who has had problems with scalp issues knows that a scalp issue can be very irritating, very embarrassing with dandruff and those types of issues. So it's very important to make sure that that grooming is followed through for every patient. It gives people a sense of love and belonging and self-esteem. Much of your self-esteem as a teenager rests on how you look. If you don't look good, you're embarrassed, you don't want to go to school, you don't want to be seen by people. So it's the same way with adults as well. People differ in their grooming measures, as with any of their self-care measures, and you need to keep that in mind when you're taking care of people. Make sure you find out more about how they are used to grooming themselves, what routines they normally use, and try to incorporate that as much as possible. So, and there are some people who might have difficulty with grooming, and they may need to use adaptive devices. You will see some of those when we are at Menorah Manor. There's a slide showing some of the adaptive devices that are available. In A, you see combs and brushes with long handles. Many older people are not able to bring their arms up over their shoulder level, and because of that, they have difficulty with combing and with brushing their hair. But some devices like this are very helpful. They also have bigger handles, which makes it easier for them to be able to hold on to them. In picture B, you see a button device. So that patients who have difficulty with manual dexterity because of either arthritis or weakness from various afflictions, they are able to use this to pull the button into the hole. In picture C, you see a device used to pull socks up a foot and a leg, which is very helpful because that can be very difficult for many older people. And the final slide shows a device used to be able to pull shoes off. So there are many more devices that aren't even shown in these pictures, but all ways that a patient can maintain some sort of independence when they have a disability. So now let's talk about hair care. This is going to be the first half of this talk. Everybody knows that the look and feel of hair affects your well-being. If you're having a bad hair day, it's just a bad day all around. As you guys can remember, I had a mishap with my hair care and ended up with really short hair for a long time, and it did affect my well-being. I hated it, and I'm glad that it's finally growing back. So it does affect your well-being. As a nursing assistant, you're going to assist with hair care wherever it's needed, and whenever it's needed, and we're going to talk about different ways that you can help a patient with their hair care needs. The nursing process in terms of hair care should reflect a number of things. One is the person's culture. There are many different cultures that have certain feelings about hair. Some of them have that it's not seen as a good thing for women to cut their hair. The Muslim community believes that women's hair should be covered in some sects of the Muslim religion. So there's a person's culture will certainly affect how they take care of their hair, and as a nursing assistant, a healthcare provider, you need to be sensitive to that. Personal choice is certainly something that plays into it. There are some men who like long hair, even though you may feel that they don't look good with long hair. That's their choice, and they have the ability to keep that. Also, there's some medical conditions, skin and scalp conditions, that will affect hair care, and we will be talking about those in just a few minutes. The patient's health history is very important. We're going to talk about patients on anticoagulants and how that has to be considered when you're doing shaving with men. Also, their self-care ability. If they have deficits that prevent them from being able to do their self-care, then that needs to be considered as well. Many of the hair care the long-term care facilities have hair care facilities hair salons right into the facility. Menorah Manor is no different. They have a good-sized hair salon with 2 stylists. You will be bringing patients down there for their appointments many times that you're there, and you're going to see that it certainly helps their well-being when they get their hair done. They're so happy, and when you comment on their hair, they just light up. So it is a really good thing for patients to be able to have. So let's take a few moments and talk about some skin and scalp conditions that you may see and may have to help treat while you're working as a nursing assistant. The first one is a very common condition. It's called alopecia. That's one of your vocab words. It means hair loss. And there are a lot of different reasons why people can lose their hair, but the most common one is male pattern baldness, which occurs with aging. And that's a hereditary condition. Men who have a full head of hair inherited that from the mother's side of the family, and they will probably maintain their hair most of their life, whereas other men have lost their hair, and there's some minor things you can do about it, but you never will have a full head of hair. Hair loss can also can occur in women. It's usually a hair thinning, and it's generally, most of the time it's generalized to most of the head. Other causes of hair loss or alopecia include cancer treatments, skin diseases. Stress can also be a cause of hair loss. Poor nutrition, pregnancy, some drugs will cause hair loss, as well as hormonal changes. So there's a lot of different reasons why people can lose their hair. On the other side of things is hirsutism. Hirsutism is excessive body hair. It can occur in men, in women, in children from hereditary and abnormal amounts of male hormones. So hirsutism you will see in a variety of people. Many times women, especially of a Mediterranean descent, will develop hirsutism as they grow older. The other condition we want to talk about is dandruff. Dandruff is the excessive amount of dry, white flakes from the scalp. And it's a very common condition. Sometimes it is caused by stress, and sometimes it's caused by different skin conditions like seborrhea or eczema. So some of them need to be treated with medical shampoos, specific shampoos, different than what you buy over the counter in your local store or drugstore. Sometimes dandruff can affect the eyebrows or the ear canals because there is hair in both of those areas. And so, once again, medicated shampoos or medicated treatments for those specific areas may be used and part of the person's care plan. All right, some other conditions, hair conditions that can occur are a little more difficult to deal with. One of them is pediculosis, which is lice. It's an infestation from a wingless insect. It can be very distressing. I don't know if during your school years you've been affected by lice or had schoolmates that have been affected, but it can be quite distressing, embarrassing, and difficult to treat. Pediculosis capitis is the infestation of the scalp with lice, and then there's pediculosis pubis, which is the infestation of the pubic hair with lice. The slang term for that is called crabs, but the medical term is pediculosis pubis. There's pediculosis corporis, which is the infestation of the body with lice, and that can be very distressing because it's just everywhere. So lice is easily spread to others through clothing, head covering, furniture, beds, towels, bed linens, sexual contact. They're also spread by sharing combs and brushes, so you want to limit how much of that takes place with you and your friends, because that can be a way that lice can be spread. Treatment involves medicated shampoos and lotions and creams, and thorough bathing and washing of the clothing and linen in hot water. So pediculosis, you want to report any signs and symptoms of lice to the nurse at once. If you see if you have a patient who complains of any tickling feeling or something moving in their hair, if you see any itching, which is unusual for that patient, any irritability, because especially with a demented patient, they may not understand that it's an itching that's the problem, and they become very irritable, and that's their only symptom. Or if you see any sores on the head or body caused by scratching, and any rashes. On the hair itself, you might see some eggs, which are some white spots along the shaft of the hair, and it's difficult to take off. It's not like dandruff that with combing will come off. The nits, as they're called, N-I-T-S, are sometimes very difficult to take off. So this is a picture here showing some of the nits in the hair, and a picture of what the lice bug looks like in a magnified view. But that's what it would look like in the hair. Scabies is another skin disorder caused by a female mite. The female mite burrows in the skin and lays eggs. So this is not only found in the scalp, but it can be found anywhere on the skin. And you will see the track marks of the burrows that the female mite will make. The person has a rash and intense itching, and persons that are at risk are those living in crowded areas, in settings for those with and those with weakened immune systems. So it's highly contagious. So once it is discovered, usually the people who have been around the person with scabies must also be treated. Some common sites that you'll see the scabie burrows are between the fingers, around the wrists, in the underarm area, or on the thighs and in the genital area. The breast, the waist, the buttocks are all areas, obviously areas that are kind of hidden and not easily noticed at first. Treatment, once again, includes special creams, cleaning of the person's room, and washing the clothing and linens in hot water. So another very distressing condition that can occur with hair and skin. This is a picture of a burrow that a scabie has caused, and you may see those in a patient who, so if you have a patient who's complaining of a lot of itching, very irritable, and you notice these areas, then you of course want to report that to the nurse immediately. All right, so now let's talk about general hair care, brushing and combing hair. You want to encourage patients and residents to do their own hair care, like we said with any of their self-care, and you assist as needed. Provide hair care for those who cannot do it. Usually brushing and combing of hair is part of the oral and morning care, afternoon care, and once again at bedtime, or whenever it's needed. So you want to be sure you do that for people who cannot do that. The person chooses how to brush, comb, or style their hair. So you assist them in terms of doing it for them, but make sure that you ask them how they want to have it done. Brushing and combing prevent tangling and matting of hair, which can cause problems with hair care in general once it starts getting matted and tangled. To brush the hair, you want to start from the scalp and then brush or comb the hair to the ends. Brushing from the scalp helps take some of the oils from the scalp and bring it down the hair shaft to keep it the hair soft and shiny. So you want to be sure to do. And this is a picture of somebody combing someone's hair. There are some hair more difficult to care for, and you need to keep that in mind. We'll talk about that in just a second. So one thing is you don't want to braid hair without the person's consent. I mean, it may appear to you that their hair is a little unruly, but you can make the decision to braid it. Ask them if they wanted to have it braided, and in that case, you'd be able to do that. You never want to cut any matted or tangled hair. That would be something that the nurse would address with the patient and the family. There are special measures that might be needed for curly, coarse, or dry hair. So if you're not familiar with the hair care for that particular patient, you'll want to check the patient's hair care practices and products, which should be listed in the person's care plan. Having difficulty finding the pause button. When you are using combs or brushes, you want to use a wide tooth comb if you have anybody with curly hair. Also, you want to be careful if there's any broken teeth on the comb, because it can be sharp and can injure the scalp. Make sure that the bristles are soft, or so that the scalp is not damaged when you're caring for the person's hair. Now, with shampooing, there are many factors that affect the frequency how frequently you would do their shampooing. One of them is the condition of the hair or the scalp. If they have a condition that requires medicated shampoos, you probably would have to do it on a daily basis. Also, their hairstyle. If it's someone who goes to the hair salon, that might only be a once-a-week shampoo. Once again, personal choice plays into it. Some patients don't like to wash their hair on a frequent basis. Shampooing, you would shampoo the hair when the nurse tells you to. The nurse will also tell you what method to use, and the method will depend on the person's condition, any safety factors, and the person's personal choice as well. Most people shampoo at least once a week. Some shampoo 2 to 3 times a week. Others shampoo every day. So once again, all of that will play into that. Along with shampoo, there are some people who use conditioners, and you'll want to find that out before you begin to shampoo a person's hair. So there are various ways that you can shampoo a person's hair. One of them is during the shower or a tub bath. You would do the shampooing then. Another way is at the sink, and we'll show you a picture of that in just a second. You can also use a stretcher that is rolled up to the sink, and I have a picture of that as well. Or you can do it in bed, and there'll be a picture showing that as well. Hair is dried and styled as quickly as possible after the shampoo, and that's so that you don't cause any drafts for the person and have them chill, because their hair is wet and can cause them to be chilled. A lot of heat loss occurs through the scalp. Check with the nurse before curling or rolling up hair. When shampooing is done at the sink, you use a folded towel placed over the sink edges to protect the neck. And we'll show that in just a second. Here is a picture of somebody getting their hair shampooed at the sink. A stretcher has been raised up and brought even with the sink. Notice how there's a towel under the neck so that any water that splashes up in that area won't drip down onto the floor or onto the stretcher. And the person's eyes, of course, are covered for that type of situation. The next picture is a picture of a patient having it done in bed. And there are these special trays that are used that you place the head in, and it has a funnel area. You can see it to the left of the picture, and you are able to wash the patient's hair. That funnel goes into an empty garbage can where you take the trash bag out and use the garbage can as a receptacle for the water, or some places have special containers that you can use to catch the water. Next, we're going to be talking about shaving. A lot of the girls in the class may not be familiar with shaving, although you do shave your legs, so you do have some experience with it. But shaving men has some considerations that we need to consider, that we need to talk about. So many men, as with any of the personal care or grooming issues, get a lot of comfort and mental well-being with shaving. There are other men who don't like to shave. They find it irritating to their face, and they like the look of having a beard. So that all needs to be considered. Many women shave their legs and underarms. Many times as a woman ages, she does not like to do that anymore. So once again, you need to consider the preferences of the patient. Some women have facial hair that they like to take care of. Some of them do it by shaving. Others use hair removal products like waxing or plucking, threading, or actual creams that actually dissolve the hair. The one thing about hair removal products, many times they can be irritating to the skin. So you only want to use those at the discretion of the nurse, whatever she has in there, she or he has in. Here in this picture is a picture of an electric shaver or a safety razor. A safety razor is done manually. Electric shavers are generally battery operated because you don't want anything connected to an electrical source to come in contact with the patient. So you may have either one of those products available. Electric shavers sometimes are used on a communal basis, and so after you use it, communal meaning that the facility owns it and uses it for a number of patients. In that case, you want to be sure that you clean and disinfect it between each patient use. So safety razors or electrical razors are used, and you want to follow the agency policy for cleaning the electric razor if you do use it. Safety razors are not used on persons who have healing problems or anybody who takes anticoagulant medications. Anticoagulant medications are medications that prevent or slow down blood clotting. There are many people who are on that for various medical reasons. Most commonly, if they are in atrial fibrillation, that might be a reason that an old person would be on blood clotting medications. If they've had a history of blood clots in their legs or blood clot to their lungs, they may also be on anticoagulant medication. Another reason would be somebody who has an artificial heart valve, that is a mechanical heart valve and not a pig or a beef heart valve. So if in these cases, when they are on an anticoagulant, bleeding can be very difficult to stop, and sometimes even a nick or a cut can cause serious bleeding. So in those cases, we would not use a safety razor. That piece of information should be in the nursing care plan. Whenever you shave a man, you want to soften the beard before shaving, and you do that by applying a nice warm towel to the beard, warm wet towel to the beard for about 2 to 3 minutes before you start shaving. Mustaches and beards need daily care. You ask the person if they want their mustache or beard groomed. Never trim a mustache or a beard without the person's consent. Even though you may think it looks unruly, you need to remember that that is the person's choice of whether they want that trimmed or not. A few things about shaving. In this diagram, you see a gentleman who is getting shaved. When you are shaving a man, there's certain things you need to know. One is before you start shaving him, you want to soften the beard. So you take a wet, warm cloth and you lay it on top of the area that has facial hair and let that sit for a couple of minutes. Then when you take that off, you apply shaving cream. Shaving cream also helps to soften the beard, but it also makes a slippery surface for the safety razor to be able to glide against. Here in this photo, you see the direction that you should shave. You want to go with the hair growth, so it's always in a downward motion toward the neck. Because wrinkly skin can be more prone to being nicked or cut, you want to be sure to hold the skin taut. And also, many older people don't have as much facial fat, and so they also have some muscle wasting, so they have a lot of more sunken areas in their face. Somebody who doesn't have teeth, who is a dentist, then that person, you'll be even more challenged to trim, especially around their mustache area, under their nose, and in their cheek area. So you just want to use a lot of care and caution with those patients. All right, well, that will end this part of chapter 23. A few things that I want you to review in your book are the blue boxes that talk about the rules for shampooing and for shaving. Those are found on pages, the rules for shaving are on page 374, and you should be familiar with those. And the rules for shampooing, I don't see specific rules for those, but you'll want to look at the delegation guidelines for brushing and combing hair, which is found on page 369. And that will cover this section. Thanks for your attention, and we'll see you on the next PowerPoint lecture.